So biomimetic dentistry is a buzzword in dentistry. It's been around, I would say, for the last 5 to 7 years. Now, what is biomimetic dentistry? The other words that I would use to describe it is minimally invasive dentistry or tooth preserving dentistry. I'm going to give you some examples. So in days gone by, many dentists did the silver fillings, or we used to call them amalgams, the mercury-based fillings. And these fillings required you to cut the tooth down quite a lot. And the philosophy behind that was that we've got to have a very strong filling material, right? So we're going to cut down a healthy tooth structure just to make sure that the filling material is strong, right? Today we do the absolute reverse, right? We're not cutting down a healthy tooth structure. Today we use lasers, we use air abrasion units to literally just remove the tooth decay so that we can use a smaller filling material and we can preserve the tooth. So biomimetic dentistry or minimally invasive dentistry can apply to simple fillings, right? But it can also apply to teeth that are broken down, right? Normally when teeth are broken down, most dentists will talk to you about a crown or a cap. And what a crown or a cap is, we're cutting the whole tooth down, and we're putting a cap on top of the tooth. So we're destroying maybe 70% of the tooth to put a covering on top of that tooth. Now ask yourself, does that really make sense? If part of the tooth is broken, we're going to destroy more of the tooth, right? Ask yourself, does that make sense? So today we have adhesive technology, minimally invasive technology, whereby we're able to remove part of the tooth and bond pieces of porcelain on the tooth to increase the strength of that tooth. The advantage of that is that there's going to be a less likelihood for root canals. Right now, biomimetic dentistry, we talked about simple fillings. We talked about crowns and replacing them with things like inlays or onlays, which are minimally invasive. We can even apply biomimetic dentistry to implant dentistry. Today there is a treatment concept whereby teeth are removed, the whole bone is removed, and implants are placed. Now, why would we want to do that? Why would we needlessly remove a patient's bone to place implants? So biomimetic dentistry, when we apply it to implant dentistry, is we're trying to preserve bone, we're trying to preserve gum, and we're trying to use minimally invasive techniques to give you what nature had given you, right? We want to replace what is missing. We don't want to take away more than we need to. So in a nutshell, biomimetic dentistry is tooth preserving, minimally invasive dentistry with a predictable outcome.